are still trickling in. My name is Nadia. I'm joined by Claire, my co-host. We have a fantastic presentation today, but before we get started, we'll do our question of the day, and we'll also have some time for national updates. So Claire, do you want to kick it off with the question of the day?
Sure. Yeah. Hi, everyone. Good morning, good afternoon. So question of the day, which we'll put in the chat, is share an act of kindness someone displayed towards you recently. So share an act of kindness someone displayed towards you recently. It can be big or small, but just something that made you smile, picked you up in your day. I think it's always a good way to start the week. Thanks, Allison, for putting it in the chat. I'm happy to start, and then I'd love to hear if anybody else has something. It's small, but it meant a lot to me. I was having a pretty long week and feeling a little overwhelmed, and a coworker just randomly brought a few flowers and gave them to me just out of the blue, and that made my day. I didn't even realize I like flowers that much, but I put them on my desk for a while and then brought them home. But yeah, it was just a small gesture. She was like, oh, I was just at the grocery store and grabbed them for you. And yeah, anyway, it really meant a lot, and it picked me up in the week. Oh my gosh, Brandy's neighbor bought her margarita machine. Love it. Does anyone else want to unmute and share an act of kindness someone did for them recently?
Hi, this is Amy from Crestwood, Kentucky, representing Adopt Me Bluegrass. And recently there was a meeting, and I didn't think much of it at the time, but someone who attended the meeting apologized to me for an incident that occurred to the meeting or at the meeting. And I thought it was really great that he was concerned enough to do that when I didn't think it was that far out of bounds. And I guess that goes to show that we are really becoming desensitized to when people are rude and inappropriate. But he went out of his way to apologize, and that really made me think, and I appreciated it.
I love that, Amy. That's great. I'm seeing some really good ones in the chat here. Pizza, margaritas, baking cookies, or compliments on cookies. And yeah, acts of service too. Coworker offered to stay late to accept surgery animals so you could go home and celebrate a family member's birthday. I love that. That's great. Thanks all. I think it's easy to just forget some of these good things that happen in our week, and paying it forward, what we can do for others too. So Nadia, hats off to you. You came up with this question and I absolutely love it.
Yeah, I thought we could all use a little boost, and it's always nice to hear from others what kindness is coming their way and acts of kindness that they're doing for others. So keep it coming, please. We all need some tips. So I'm going to move us over to national updates for a few minutes. And I believe that we have somebody from Maddie's fund who wants to make an announcement about Camp Maddie. And then from there, please feel free to put in the chat, unmute, and share away.
Thank you, Nadia. Yeah, that's me, Dr. Sheila Segerson, Director of Community Solutions at Maddie's Fund, and excited to announce that we're having Camp Maddie this week on March 20th, Thursday, from 9 a.m. to 1 p.m. Pacific. And we'll be talking about determining which dogs are safe to rehome, keeping dogs happy and healthy while in care, and getting them out and finding them home. So all about dogs, March 20th and April 3rd. We have some great speakers, Dr. Chris Pockle, Dr. Wailani Sung, Mike Shikashio, and lots of others. So hope to see you there. Thank you.
Thank you, Sheila. Are there any others who want to unmute and share?
Hi, Nadia. We chatted a little bit about this just in advance of this call, but a reminder to anybody who hasn't yet registered The Humane Canada Summit for Animals is coming up in Halifax, May 5th through 7th. It is in person only, I'm sorry, but we'd love to see as many of you as possible in Halifax. And of personal note, today and until tomorrow is a flash registration sale. You can save $100 on the registration fee, and because the majority of you are in the US, your dollar goes farther. Thanks very much.
Thanks, Kathy. I think we have time for one more if anybody else wants to share.
Hello, this is, oh.
Yes, we'll do two
no,
more. Go ahead.
This is Vincent with Maddie's Animal Support Service Project, otherwise known as HAAS. One of our HAAS shelters is looking for a director, Oakland Animal Services. So if you're interested, I am going to put the announcement in the
Hi, everyone. This is Jennifer Comas from the Humane Society of the United States. I just wanted to remind everyone to register for Animal Care Expo. Animal Care Expo is May 15th through 18th, and we welcome you to join us, and I will drop the link in the chat as well.
Thank you. So I think we can move on to presenting our speakers. Before I do that, the My Dog is My Home summit is happening next week. So I will find the link and drop it in the chat momentarily. And it's very relevant to what we're going to hear about today. So with that, I would like to welcome Jesse and Lauren. Please tell us where you're joining us from and take it away. Thank you.
Thank you, Nadia. I am going to go ahead and share my screen. Okay. All right, so thank you and good morning, or at least morning here in San Diego. I'm so excited to be a part of this call today. I'll kick us off and then I'll pass things over to Jesse to share some information about Father Joe's and their co-sheltering program. My name is Lauren Rogers and I'm the Community Initiatives Manager at San Diego Humane Society. I'm originally from the San Francisco Bay Area, but I moved to San Diego for college and just haven't left. My first job out of college was at a small nonprofit called Paws San Diego, which provided different pet support services for vulnerable populations. And the mission of providing support to keep pets with their families really spoke to me. So I've continued down that line of work, overseeing various pet retention programs along the way. Currently at San Diego Humane Society, I manage some of our intake diversion efforts, including our safety net foster and supported self-rehoming programs. And I also do some work with homeless service and domestic violence providers, which is where I started learning about co-sheltering, or the practice of housing people and animals together at the same temporary facility, and the topic of our call today. A bit about San Diego Humane Society. So we were founded in 1880. We're a private shelter with animal services contracts for 13 cities in the county. We have 5 campuses and care for about 40,000 animals annually, and that includes both domestic and wildlife. So we care for about 30,000 domestic pets annually and 10,000 wildlife through our wildlife program. And we've actually maintained zero euthanasia of healthy and treatable animals since 2002. But what makes me especially proud to work at San Diego Humane Society is our community programming and really trying to approach keeping families together from every angle. And then just for context, a bit about San Diego County. So we're a large county at 4,500 square miles. We have a population of 3.3 million people. We're a border city and a military city with a very high cost of living. In fact, US News and World Report ranks San Diego the most expensive city to live in this year. And that's due in large part to the cost of our housing, which has caused us to have the fourth largest homeless population in the country at 10,264 people experiencing homelessness, according to our 2023 point in time count. And I did want to mention that currently all of the city of San Diego contracted homeless shelters are pet friendly. We like to think that Father Joe's kind of led the way and we're the trailblazers in that effort. But of course, there are still plenty of shelters within our county that only allow assistance animals and do not allow companion animals. And that's something that San Diego Humane Society is trying to improve. So in terms of partnerships between human service and animal welfare organizations, when Jesse and I started talking about this topic, we really agree that it starts with acknowledging that we are serving the same population and that we can be more effective by looking at the family holistically as both the human members and the pet members. So if we're wanting to get started with a partnership, we'll of course want a contact, right? And if we don't have a contact, what I found to be really effective in terms of meeting people from the human services sector is attending the meetings and events where they are. So for example, our staff will attend homeless resource fairs with other providers. So that'll be groups that are providing healthcare, shelter opportunities, substance abuse programs. And then San Diego Humane Society is there sharing about what services we offer. So it's not only a nice opportunity to connect with community members and help them with their pets, but also to connect with other providers who will often come up to our table and say they're so excited that we're there, and we'll just get to chatting. But some other things that we do are attend our domestic violence council meetings, as well as our bridge to housing meetings. So we're in the same room with the people who are wanting to do all of the same things that we are. And then once we have a connection established, we can schedule a meeting with that provider to discuss what we're each hoping to get out of the partnership and how we can each help each other get there. And I'll discuss some ideas for partnership opportunities on the next slide. And then from there, it's just ongoing evaluation. So we're staying in contact, we're communicating about how things are going, any new needs. Are we both kind of getting what we were hoping to get out of the partnership? And if not, I think there's opportunities to evaluate, maybe this isn't the right partnership. We certainly want to avoid the mindset of, oh, well, we're just partnering with this agency because we always have. We'll want to maybe move resources to a different partnership where we can achieve better outcomes. Partnership ideas. So starting with best practices, I think this is a really important part of partnerships, and it's just how can each agency share the best practices for working with their population. So how can we as animal service providers learn from our human services counterparts about working with vulnerable populations? And then vice versa, what can we as animal service providers share? So some ideas and things that we've shared before with our partners are pet handling and safety tips, common veterinary and behavior concerns and how to mitigate those concerns, humane housing and cleaning protocols for pets to minimize stress and contamination in a shelter environment. And then enrichment ideas to keep pets busy when they're in a shelter environment, since there's often a lot of stimulation, and even information about emotional support animal documentation. Programs and services. What is the agency not currently able to provide that would be helpful? And I'll get into more ideas for that on the next slide as well. And then funding opportunities. Are there funders who will support each agency's respective program or their partnership? We're all working with limited budgets, and I think having that dedicated funding to support the program is really helpful and can also help address those unexpected expenses as they come up. We're often sharing funding information with our partners. Red Rover is one that we come back to over and over again. They have safe housing grants that offer funding for domestic violence shelters to establish pet programs. And they even recently piloted a version for homeless shelters. But of course, there's other funding opportunities as well. And then lastly, just spreading the word. We want to share about how we're helping each other. Of course, this could lead to new funding sources, partnerships, or even volunteers who may not have otherwise connected with your mission, but do now because of the population that you're supporting because of this partnership. And here is a long list of ideas for programs and services. I, of course, could talk about each one individually, but we only have so much time. But these are just some of the things that we've done. I fully recognize that every shelter or agency has different resources, and there's so much to be said by just having a relationship established with a partner agency and having that open line of communication to bounce ideas and questions off of each other, or to even provide referrals to each other's programs or third-party programs if you're not able to offer these direct services. But some of the things that we've done are offering pet food and supplies, veterinary care clinics, that's of course a huge need, grooming support, behavior and training support, to really help address any of those in-shelter behavior concerns. We share information about our pet boarding or foster care options. We'll always advocate for keeping families together in a shelter environment when possible. But when that's not possible for behavior or other reasons, we want to make sure that there's another option where we can hold the pet until they can be back with their person. We've offered youth programs for shelters that have youth as residents, and those have been really nice. Speaking opportunities, so either we'll go and speak to our partner agency's staff, or they will come and speak to us and share information, kind of along the best practices lines that I was talking about. And then landlord engagement strategies. So if a client is in shelter with a pet, and we of course want to set them up for success, moving forward and hopefully getting into longer term housing, we can share things like working with a landlord about being pet friendly, like creating a pet resume or getting renter's insurance or having the landlord meet their pet if that's appropriate. And then lastly, just flyers or other materials. So we always make sure that we set our partners up with our one sheet that has resources for people experiencing homelessness in the county and where they can go and access help. So that's obviously a very quick overview, but I will go ahead and pass things over to Jesse, and she can share about Father Joe's.
Thank you, Lauren.
Yeah.
Great. So I'll let you pop over to our slide there, and I'll start introducing myself. So my name is Jesse Casement. I'm the Division Director of Client Services at Father Joe's Villages. We're a large provider of homelessness services in downtown San Diego, and then we also have scattered site locations across mostly San Diego into South Bay and other areas. But we also operate rapid rehousing programs and permanent supportive housing vouchers that go throughout the county. You can go to the next slide, Lauren. Maybe.
Sorry, it's not switching.
Oh, it's not. Huh?
You want to just refresh your screen, kind of log out, log in again?
Yeah.
Could be an internet thing.
Okay.
Real pretty though. I'm getting some nice comments in the chat. Very informative.
Well, while she's doing that, I started with Father Joe's Villages in 2010 when I moved here from California, or from Kansas. I moved to San Diego from Kansas in 2010. Father Joe's is the only place I've worked since I've been here. I can't imagine being anywhere else. I've been working in human services for nearly 20 years, but my education is in conflict resolution and reconciliation. Any luck with that one? I can always share my screen, Lauren. That's okay. Let me pull up.
Sorry, Jesse.
Yeah, that's okay. That happens.
Yeah, we were good, and then
Just one second. Okay, can you
Looks
see?
good, looks great.
There we go. So that's my cat who didn't want her picture taken, but she's got pretty eyes. So my education is in conflict resolution and reconciliation, and I've found that to be very helpful in the line of work that I do, where people are coming from a background of trauma, maybe some broken family relationships, tense experiences with past landlords, friends, employers. So helping people to work through that conflict is really a passion of mine. I do have also a background of working in humane society settings and in veterinary office settings. And that really is reflective of my passion for animals and working with animals, but now primarily keeping people with their animals. So I want to keep people and pets together. At Father Joe's Villages, our mission is to prevent and end homelessness one life at a time. We do that through the utilization of our creed, where we expect our staff to extend compassion, respect, empathy, empowerment, and dignity to every person with whom they interact. At Father Joe's, we also really work with our clients to help them to embrace this creed so that they can interact with our staff and with the community and with each other in a productive way. Father Joe's Villages was founded by Father Joe Carroll, our president emeritus. He did pass away in 2021, and our chief executive officer is now Deacon Jim Vargas. So Father Joe's began as St. Mary of the Wayside Chapel and was established in 1950 to serve San Diegans experiencing homelessness and poverty. Here we are nearly 75 years later, and we've grown to include a comprehensive campus and scattered on-site programs that house over 2,000 people nightly. We divide our services into 4 pillars of care, the first being meeting basic needs. Under that, we really categorize our housing programs, which includes our shelter, rapid rehousing, permanent supportive housing, and affordable housing programs. We also provide a public lunch line meal every day, 365 days a year, 366 this year, to the public, and then also 3 meals a day to our clients that are living with us in shelter. We have day center services. That's a drop-in facility for people who are currently unhoused, living on the streets, so that they can come in, do their laundry, take a shower, charge their phone, get connected to resources like the San Diego Humane Society. So that meeting basic need is the primary pillar that we're going to talk about today in the rest of this presentation. But I also will briefly review the other 3 pillars. Investing in children. We do have a licensed therapeutic childcare facility on site that includes licensed childcare, after school programming, therapy, and resources for families. Our goal there is really to break that cycle of homelessness. We prioritize making health a priority, and we do that through a federally qualified health center that is here on our campus, where they offer medical care, dental care, behavioral health services, and then also drug and alcohol programs, including medical assisted treatment. And strengthening self-sufficiency is our 4th pillar. That's where we have employment and education programs. We offer vocational trainings in hot jobs in the area that can be quickly trained in. So we have culinary arts training programs, security, custodial, property management, program, so that we can help people get employed quickly. And then we also have a chaplaincy program that is not required, but that is offered to all of the people who are wishing to access services here. But like I said, for today, we're going to focus on that first pillar, meeting basic needs, and specifically shelter. So like Lauren said, we've got a large number of people who are unhoused in San Diego. In 2023, Father Joe's Villages served 12,952 unique individuals. The demand is huge. And we know that people who are unhoused are more likely to have serious illness, mental health issues, substance abuse, and experience violence. In fact, we know that people who are unhoused are 3 to 4 times more likely to die prematurely, 3 to 6 times, have a 3 to 6 time higher rate of illness than their housed peers, and are 10 times more likely to be the victim of a violent crime. So when you combine the number of people who need our services and really that vulnerability that the people are experiencing when they are unhoused, Father Joe's Villages really felt it was necessary to design shelter that allows for client choice, but that also restricts or reduces the number of barriers to access. In our shelter programs, we operate those in 4 separate buildings. Each of our shelter designs is slightly different. We'll talk more about that in a bit. But we do have a mix of single rooms where maybe one family lives in that space. We also have shared rooms where there could be 2 to 4 roommates in one room. And then we have congregate living, which is really bunk beds in an open air environment. We have 1,048 total shelter beds that we operate each night. That does not include our inclement weather shelter. 246 of our 1,048 total shelter beds are dedicated to families with children, and then the remainder of our beds are dedicated to adults living without children. Our inclement weather shelter is, like I said, in addition to the 1,048 beds, it's a seasonal shelter that's operated in November through March of each year. So we're hitting the tail end of this current inclement season. And those beds are opened and operated when we're having cold, wet, or otherwise extreme weather for San Diego. I'll put that qualifier there. I know the rest of you across the country may not consider our inclement weather inclement, but for us, it can be cold and wet, and we bring people inside. Those inclement weather shelter beds are offered in our dining rooms. So in 2023, Father Joe's provided 366,000 shelter bed nights, and a bed night is defined as one body in one bed for one night. So 366,000 nights of shelter. Those shelter program models are a mix of everything from emergency shelter, which can, be a quick stay, to transitional housing, which is a longer stay with more wraparound services. We also offer recuperative care. That is a shelter environment for people who are exiting a medical facility or are preparing to go into a medical procedure and need a space to safely prepare for that procedure to be done. And then, like I said, the inclement weather shelter. But I'm very happy to report that 100% of those beds are pet friendly, regardless of the design. So just a quick glance at our campus. Up in the top left corner, we've got our Joan Kroc Center. The shelter operates on 2 floors and 81 rooms. That's where our families live. And then we also have programs for single adults. In the top middle of the screen, we have our Bishop Maher Center. Shelter operates on 2 of those floors. In that same building, we also have our licensed childcare facility. And then above the shelter, we have permanent housing. So the shelter floors, though, are 2 floors, 33 rooms, 66 beds, 2 people per room. Down in the bottom left, we see our Paul Mirable Center. Shelter is operated on 2 floors. There's 350 beds in a congregate living setting. And those 3 buildings make up what we call our campus. The inclement weather shelter is in our top right corner of this slide. That's just an example of how we set up cots. So all of the dining room tables are moved out of the way, cots are put down, and we bring in up to 134 people per night when it's cold and wet outside. And then they leave the next morning before breakfast for our shelter clients. And then down in the bottom right, we're also the operator of a city-funded shelter called Golden Hall. That is off-site, it's off our campus. It is 1 floor of shelter, 324 single adults living there in a congregate living environment. So as I mentioned, all 1,048 beds are pet friendly. And so we call that co-sheltering. Co-sheltering is the practice of providing shelter to people with their pets. And co-sheltering can look very different depending on the design of the facility. At Father Joe's, we started co-sheltering in 2020. We were always assistance animal friendly. We have to be as a housing provider in California. So of course we accepted assistance animals, emotional support animals and service animals. But in 2020, we made the decision to extend to pets. And so we didn't, build a new building or create new facilities in order to do that. We used our existing facilities. And I like to talk about that because I think if a program is really stuck on, can we make it happen? You're going to see more pictures in a little bit, but we use whatever we have and we've been able to make it work. And I feel like there's just been some small modifications that had to be made to be able to do so that didn't cost any, if not just a little bit of money. And so I really like to talk about that because I don't feel like your existing facility should limit you in your ability to provide animals. Pets to us can have hair, fur, feathers, fins, shells, scales. We don't just limit to dogs and cats. We just recently had a chameleon in the program. We frequently have birds and fish. And so, whatever that animal is, as long as they're considered a pet, we welcome them into our facilities. The reason we co-shelter is we want to be low barrier. And so we know that there are 3 primary reasons that people will not come into shelter. Those are referred to as the 3 Ps. people, property, and pets. So if people who are unhoused cannot come into shelter with the people that they consider their family or their community, whether biological or chosen, they may be inclined to refuse a shelter bed. They also will not come into shelter if they cannot bring their property. That means something to them. For a lot of people, that's the last that they have of their past home. And so we want to make sure that we can help them coordinate. Even if they can't bring all of their property into our space, there are local storage programs that we like to get people set up with so that they feel safe about their property and they know their things are being taken care of, and that doesn't restrict them from coming inside. And then we definitely know that people will turn down shelter if they can't bring their pets in with them. So that was the barrier that we sought to remove by becoming a co-sheltering campus. We know that pets are family. Mine are. I'm sure everyone on this call thinks of pets in the same way. And so we didn't want to separate families from one another. The same way we bring in, parents with their children, we want to bring in people with their pets. And we know that pets save lives. It is not uncommon at all for us to hear stories about pets being companions and protection for people while they're housed and unhoused. Some of the examples we get is that a dog may alert from inside a tent, and that can make a client feel more comfortable that they know what's going on around their tents. We know that a lot of our female clients start using drugs while they're on the street so that they can stay awake and safe at night instead of being assaulted while they're sleeping. So it keeps them on guard. But their pets also can help them to feel safe in that setting. And then we know from our clients that pets provide, schedule and motivation every day. They have to get up to take their dog out to feed their animal. The animal is going to be on a routine, so that forces some routine for the human as well, which can be helpful when someone's struggling with depression or other lack of motivation in some way. And then it is from time to time that we hear clients say that quite literally they are still alive because they didn't know who would take care of their animal if they took their own lives. And so I always say if us allowing a dog or some other pet to come into our shelter means that someone made the decision to be here for another day, then we've made the right decision as an organization. Just a little bit of difference between pets and assistance animals. This is a lot on the slide. You can always go back and look at it, but I want to highlight number 3 and number 5. At Father Joe's Villages, the pet must be in possession of the client at program intake. We don't allow someone to get a new pet while they're already living in shelter with us. Assistance animals, ESAs and service animals, can join the household at any time because they're an accommodation for a disability. But a pet must be in possession of the client at program intake. The reason for that is that we know that having a pet will make it harder to be housed, and we're working with all of our clients to get them into their next phase of housing as quickly as possible. So we don't want them to take on new challenges while they're living with us in shelter. When they exit, they are welcome, of course, to get whatever pets that their new housing will allow. But that's one difference that we have. And then on number 5, pets are restricted to pathways of travel. So in our courtyards, hallways, and lobbies, and then they're allowed in our outdoor areas and the client's room and bed area. Assistance animals are allowed in all of our common areas, including our dining hall, classrooms, et cetera, as an accommodation for persons with a disability. So full recognition that ESAs and service animals are different and can be categorized differently, but at Father Joe's Villages, we don't distinguish between the two. So ESAs and service animals, we allow that bigger access, whereas pets are more restricted. And then I will go ahead and call out number 4, which is that we as an organization made a decision when we started co-sheltering to put a restriction on the number of pets, not assistance animals, that could be served in each program. We've never hit that limit, but it made our leadership feel more comfortable when we were opening up to pets, that we had a built-in limit that we could expand if we needed to, but that way it didn't result in a giant flood of animals. But like I said, we've never hit that bar. So to date, since 2010 through March of 2024, we've served at least 694 animals and at least 527 animals. I say at least because it took some time to develop good track records around data entry regarding animal enrollment. When we first started serving animals, our staff weren't thinking of enrolling them in the system, but our data has improved. But I know we've served at least 694 animals, maybe quite more. Currently, this data is accurate. Right now, as of last week, we had 30 animals in 30 households. So 1,048 beds, but only 30 of those households have animals with them. I like to point that out because for an organization that's on the fence about opening up to co-sheltering, we just didn't see a giant flood of animals. And I think that's important to note. I will say that the data, when I try to look at trends to see if when we started co-sheltering, if we saw this spike, I don't have the data to back that up because we started serving pets right during the pandemic. And so in the shelter environments, we had to space out our clients during the pandemic to make sure that social distancing was in place. Unfortunately, in human shelters, that meant reducing beds. And so when I look and see that there was a dip in the number of animals served, I don't know if that would have been the case if we would have been serving our full portfolio of beds. But I can say that within the past 2 years, we've been pretty steady, holding out about around 100 animals per year that we serve. So 374 of our beds are in a setting like this, a semi-private room, maybe 2 to 4 adults that are sharing the space. They have a closed door. And it's just more private and a lot more quiet. It's not hard to co-shelter in a space like this. We have the occasional issue with roommates disagreeing. Frequently the disagreement is that we have a roommate who doesn't like that the other roommate is interacting with their pet when they're not in the room. And sometimes we have issues with animals being loose in the room, and then staff can't access the space if they need to come in and change out an air filter or something in the ceiling. Those are our biggest concerns in an environment like this. But that's also the minority of our beds. The bulk of our beds are in a setting like this. So in our bottom left, that's Golden Hall. And then in the right, we have Palmirable Center. So 674 of our beds are in a setting such as this, a congregate living area, which is an open air dorm, clients living on bunk beds, and hundreds of roommates. So Golden Hall, 324 clients, Palmirable Center, 350 clients. It's much more of a task to co-shelter in these spaces, but we're able to do it. So this is me cheerleading for anyone who is worried. You can do it in your space. This is what it looks like to co-shelter animals in those spaces. We make great use of crates, and we use every little inch possible. You can see in this particular picture in the bottom, there's not a lot of room between the bed and the crate, but the person and the animal are living there safely every night. And so we make do. Lots of little dogs, snuggling up on beds. We have cats who are frequently on the beds with their humans while their human is present, and then they have a crate with a litter box and everything that they need while the owner is away. So just some examples of how big dogs, little dogs, and cats can live in that space. And we do, I just want to point out, provide liners and stuff for the crates, as you can see, but this owner made the decision not to put a liner in with his animal. It's really important, we have found, to have resources on hand for the animals in shelter. We ask the clients what they need at intake to properly care for their pets, with a real focus on needs versus wants. We would love to be able to buy everything that someone wants for their animals, but we have to focus resource-wise on needs. We keep the basics on hand, so we keep, just a standard adult cat food, standard adult dog food, and small bites and large bites for various sized animals. We keep those on hand, but if someone needs something different, maybe they have an animal who has a special diet, or they've got an animal who is not a dog or a cat, and we need to go get that special diet, we're lucky to have the dollars to be able to do that. And primarily, we have those dollars through the state of California. It's called the PAWS grant, and it gives us so much flexibility in being able to order the supplies that we need, and also to be able to offer behavior classes and veterinary care to the clients who are living here with their animals. The PAWS grant has also made it possible for us to make some facility-based changes. So we were able to install multiple dog relief areas. So this is a picture of one of those areas in front of our Joan Kroc Center. We also, this year, were able to install a doggy bathtub. It's not very clean. I can never catch it when it's not in use. So someone had just gotten done using it. I apologize, I didn't clean it before the picture. And we recently had flooding, so that's why our wall is peeling back there. But this has been a great resource for our clients who didn't have anywhere else to be able to wash their animals unless they went off site. So this is another example. We shoved this into the laundry room where there's existing plumbing and electricity and everything that we needed for this table because it lifts up and down. So just make do with what you have. And then over here is a picture of one of our remodeled dining rooms. And the reason I bring this up, we didn't use the pause dollars for it, but we were already remodeling the dining room. And so now this is an example of how we keep animals in mind while we're making decisions around our programs, which we never did before. So now animals are always part of the decision. The way the dining room was designed in the past was circular tables, and dogs would get stepped on, their tail would get stepped on. And so we went with a more linear design like this and spaced out the tables, and that's been great for the animals who come down during the meals. It's less congested and less stressful to the animals. Animal-oriented services and partnerships are key. We can't get enough of our animal service partners. I get really excited every time I get to do anything with Lauren or anyone from the San Diego Humane Society. And we also have other terrific relationships with providers like the Co-Sheltering Collaborative, Red Rover, My Dog Is My Home, Maddie's Fund, of course, and then other local providers like Street Dog Coalition and Helen Woodward. So we are very, very fortunate to have resources that can provide us education, that can provide us the sort of tools and just support that we need sometimes just to talk through things. I had an emotional support rooster come into one of our programs, and I was able to lean into animal providers of what do we need, on site to be able to help this person care for their rooster. So I'm very grateful for those relationships. It also means that we have on-site preventative veterinary care. So we do have partners that come on site monthly and provide that preventative care, as well as the on-site spay and neuter services. We also have low-cost veterinary service relationships in the community. When the client exits shelter, we're always looking forward to their next step, and we want them to be able to leave successfully. And part of that is planning for how they're going to care for everything we've provided while they were with us in shelter. We make use of community pantries for people that are living in permanent housing. We swap our trainings like Lauren was talking about. The San Diego Humane Society has done unbelievable trainings for us as an organization and helped our staff to become more comfortable working around animals, which was so important. And I talk about it down here. There is some bias that folks have in working with animals. Maybe they have their own trauma and they would prefer just to work around the humans, but working at Father Joe's means you have to work around the pets. So those swaps have been really great. And then the expertise, creativity, and knowledge of our animal partners has been invaluable, especially when it comes to emergency boarding and behavior issues that we're experiencing. Otherwise, we try to make having a pet in shelter as normal and easy as possible. And I am thrilled to say that, and lucky to say that we have a really great grants and development team and a leadership team that listens and supports innovation. So I've got a lot of backup, which I'm very lucky. Lessons learned along the way. I've said it before, we did not see a drastic increase of animals served when we opened up to pets. We learned very quickly that an animal care agreement was necessary to keep expectations clear, and we do lean into that agreement when necessary, but it clearly spells out the rules and expectations of the human, and then we lean into that when we need to foresee behavior from the person or from the animal. We learned that we needed to make an emergency plan for animals. So from the day of intake, we are asking if there's an emergency. If you leave in an ambulance, who are we calling to take care of this animal? Because it can't be our staff and it can't be another client. So who can we lean into? We learned that there are never enough pet relief areas, materials, plastic tubs for food storage or crates. So whenever we see resources available in the community, we take advantage of that. We also have been gifted crates from organizations, which we are very lucky. But otherwise, Amazon and other bulk service or bulk retailers, we do utilize to make sure that we always have those materials on hand. Like I said before, small adjustments to a space can make a big difference. That dining room is just one example of how we just align the tables in a different way. We've also just slightly adjusted how beds were placed, and that made, easier access for animals and more room for crates. Education is key for our clients. We know that they need help budgeting for their animals. So that's part of what our case managers are doing while they're working with them here in shelter. We're always working with them on being responsible owners in shelter, responsible pet owners, and we expect that to translate into their relationship with their landlord and their future housing. We talk regularly with our clients about the potential for the impact on housing and employment if they do bring on a new assistance animal. We want them to be prepared for that. For staff, We needed them to learn what are the signs and symptoms of disease and abuse. We train them, the signs and symptoms of elder and child abuse, but we needed that for animals as well. As they're doing their rounds, we want them to keep an eye out for that. We, like I said, need our staff to check their personal biases regarding species and breed with, again, full acknowledgement that there could be trauma, but we need them to be able to come and provide 100% care to all of our clients, even if they have an animal that they're intimidated by. And then we need staff to have trainings around working with people and their pets. So a lot of our pets have been traumatized along with their human, and they come in with behaviors that could look like bad animal behavior, but really it's an animal who's been scared and been through a lot and feels an obligation to protect their owner. So we focus a lot on those sorts of trainings in our new employee orientation and then ongoing annual training with our staff. And those kinds of tips and tricks we get from our animal service providers. And then in the community, we are advocates for our clients, working with landlords, making sure they understand the benefit of housing tenants with pets. We know that they'll be more stable in their housing and really fight to keep their housing if they find a landlord that welcomes them with their animal. And then just the positive way pets can impact a community. We learned very quickly that empowered clients will find solutions. One example is our clients will babysit or pet sit for each other's animals, and they pay each other. So if we have a client who's leaving site to go to work, they are more than happy to pay someone else to watch their animal. And now we've got 2 employed clients. So we let them, we love it when they empower themselves, and we definitely have learned to let them figure those things out on their own. We don't have to figure everything else out for them. And then we know that co-sheltering is possible in any physical space, and it's completely worth it. So that's it for me.
Thank you, Jesse and Lauren. That is really, really inspiring. And I know you can probably see the chat now, but lots of activity there. People are really excited, and I know you've helped initiate and inspire a lot of good ideas in all over the country. So thank you so much. That was really, really good. And you addressed a lot of questions already. So we had some questions pop up, but I see you had already addressed them in your future slides. One of the first questions we just have a couple minutes here, but how are funders responding? The person who asked was assuming it's pretty warm response when you're looking for bringing in more funds, but do you have a little bit more information on that and maybe some tips for people that are trying to get funding for their programs that are similar to this?
Yeah, from the pause grant in California was significant and made a lot of changes for us. It allowed us to bring in additional custodial, which I think was such a great support to our existing team, and then also with the modifications and the day-to-day services that we need. But we do find that funders unrelated to animal specific dollars are really excited that we co-shelter. I think it helps to tell the story that you're meeting a client exactly where they are and that you want to improve your community. It's also, like Lauren brought up, we're serving the same people. So if we can keep people, with their pets, then we are also helping to keep people out of shelter or animals out of shelter. And so the story that you tell to your funder along that line is, I think, compelling and makes them want to fund. So we do see a lot of smaller private donors that are excited by that story. I don't hear that feedback as much from the bigger dollars, but we don't have that more direct communication with them.
That's great. And I see then a question from Judy is sort of similar to 2 other questions. There were a few questions, I think, when seeing the images of dogs on beds and cats on beds. Obviously, you're using a lot of crates, but there were questions about if there's any checks of pets before they enter, how do you enter, or how do you handle different species living together, birds or reptiles, dogs or cats? And then, of course, Judy's questions of other clients maybe having allergies or phobias. But it sounds like you have that expectations in MOU, but or maybe not MOU, but an agreement before they start. Any other tips on that? How to handle the co-housing?
Yeah, so Pets of the Homeless has been so generous with crates. And so crates are a huge resource that we need all the time. And we send the crates with them when they leave so that they have it at their next destination. But you know, that's the biggest way we separate animals. We definitely are not going to stress out an animal. We're not going to put even 2 dogs in the same little bed space if we can avoid it, unless the owners say it's fine. You know, some of the, I guess the most simple way to answer that question is to say, we ask the person who knows the animal. Does your animal get stressed out living around other animals? If so, we're going to try to make some adjustments in our dorm area so that we can put the animal in a more secluded space with their owner. But sometimes that means that a human has to wait longer to come into shelter. So we're just very frank with them about what we're working with. And this is, you know, the room that you're about to go into has a cat. Are you okay with that? And if they aren't, then we do some shuffling if we can. But if we can't do it, then sometimes it does result in a delay. I've never had allergies be an issue reported to me. We know that people have allergies to animals, but we're always able to sort that out. We don't, you know, we can do enough shuffling that someone who is okay living around a cat can trade with someone who would have been placed in the room with a cat. So we've always been lucky enough to be able to do that. And then just making sure that we are cleaning effectively when they leave that space. But yeah, I don't even want to like throw it out in the universe, but there hasn't been bad stuff. I'll just put it that way. I don't want to challenge the universe, but we've never had to make any decisions behaviorally about animals because our staff are trained to look for stuff in advance, and we get the human and their animal enrolled in classes right away if they need that kind of support. As far as what we're checking ahead of time, we don't check anything. We don't want to put any barriers. The person just has to bring their animal with them to the intake. If the intake staff is seeing aggressive behavior at intake, then we may determine that that animal isn't safe to come into shelter. Otherwise, we don't, you know, require any vet records or anything like that. We do expect them to get their rabies shot or make sure that they show us documentation that they're up to date on their rabies vaccine within 10 days of moving into the program.
Perfect. You answered a lot of questions in one. So thank you so much. I love how solution focused you are, and every case is an individual, it sounds like. So wonderful. Thank you, Lauren. Thank you, Jesse. And of course, Nadia for co-hosting. We're just at time, but as a reminder, I know there's probably a lot of questions and more conversation, but if you could just move it over to our Maddie's community conversations and our Maddie's Pet Forum. We will continue it there. But thanks, everyone. Hope you have a wonderful week. And thanks again, Lauren and Jesse. And we'll see you all soon. Thanks so much. Next week.
Thank you.
Have a good rest of the week.